Ladies and gentlemen, good afternoon. As every year, this year of April of 12th is celebrated as the World Health Day. Very aptly, the chosen them for this year refer to the need to safeguard and promote health at all stages of life to ensure healthy aging. Statistically, data show that by the year of 2050, an increase is expected in the population age 60 years or over that will account for about half of the total growth of the world population. As stated by the WHO, one of the 8 areas of importance to aging and health in oral health, the choice of this target indicated the importance of oral health in the wider health and the impact of the loss of the oral health both at an individual and social level. Consequences that are not only medical but also social and economical signs oral diseases are usually progressive and cumulative, and older people are suffering from many oral diseases such as caries, periodontal diseases, oral cancer, denture, and related conditions. But what do you mean by oral health and why is it so important? Oral health means more than good teeth. It is integral to the general health and essential for well-being. The interrelationship between oral and general health is evidence-based. Severe periodontal diseases, for example, is associated with diabetes. This strong correlation between severe oral disease and non-communicable chronic disease is primary as a result of the common risk factors such as unhealthy diet, tobacco use, harmful alcohol use, and poor oral hygiene. However, despite great improvement in oral health, globally problems still exist in many communities, particularly among underprivileged groups. What is the level of the oral health in Cyprus? Research results show improvement in the level of the oral health of Cypriot in the last 20 years, with the index of DMFT for 12 years all decreasing from 2.14 in 1992 to 1.25 in 2010. Besides, based on the result of the Eurobarometer, 57% of people said that they still have all their teeth, percentage which is the highest among the EU member states. However, it must be emphasized that although there was improvement in the level of the oral health, disparities still exist, but now are not related with the geographical area as was the case in 1992, but occur between Cypriot and immigrants, most of whom are coming from countries from Eastern Europe and the Middle East. Some information now about the financing of healthcare system in Cyprus. 6.2% of the GDP is spent for healthcare, which is one of the lowest among the EU countries. The public healthcare sector, which is governed by the Ministry of Health, is financed through taxation. 5% of the budget of the Republic of Cyprus is allocated to the Ministry of Health. 80% of the population is to free public care. Despite the high percentage of the beneficiary to the National Health Service, Cyprus has one of the highest rates of private health expenditure, which translates into 55% of the total health expenditure and 3.4% GDP, and 0.03% of the GDP is spent for dental care. Besides, the ratio of dentists to patient in Cyprus is 1 to 1,015. The recognized dental specialty in Cyprus are orthodontic, oral surgery, maxillofacial surgery, and oral and maxillofacial surgery. Dental care in Cyprus is provided by the public, but mainly by the private sector. Only 5% of the dentists are working in the public sector, and only 10% of the population uses the public dental services, although, as it has been mentioned at the previous slide, 80% of the population is entitled to free oral health care at the public dental services. The distribution of dental surgery, private and public, is such that ensure access to all citizens. 96% Cypriot states that they could reach a dentist within 30 minutes. The activity of the public dental services are separated in three pillars: dental public health, oral health care provision, and Department of Planning, Human Resource Development, and Coordinator and EU matters. The activity of each pillar are presented in the slide. I would like to give emphasis to some very important and innovative programs. Good practice that have been implemented by the public dental services include oral health education to all nursery and primary school, as well as advice and information to the mothers and parents, examination of all children at the age of 6 years, free dental packs with toothbrush and toothpaste at schools situated in deprived and associated area, free dental prevention and treatment with the 4 mobile dental clinics at school that are situated in the private and isolated area. Since the public sector does not have the capacity to cover the needs of all the children, an innovative program has been implemented in collaboration with the private dentist. More specifically, at the beginning of each school year, all the children aged 11 and 12 old are the first checked by a dental officer and are then referred to dentists in the private sector. Oral cancer campaign. This campaign will be started by the end of this year. The idea is to use the mass media to raise awareness of the oral cancer, and for that purpose, a short film that has been created and encourage self-examination as well as regular attendance for a dental examination. I have a very nice slide image from one of the mobile dental clinic and oral health education, and the new leaflet about the oral cancer. Other programs that have been implemented by the public dental services in order to reduce oral health inequality and improve the level of the oral health: public dental clinic in prisons, psychiatric hospital, as well as foundation for medically handicapped where the population is at high risk for oral diseases, and contribution of the partial or full denture to all low-income patients at the public dental services, and patients are paying only a small amount of the cost, €76 per denture. The Cyprus Presidency has set the following priority in the field of health aging across the life cycle, organ donator and transplantation, innovation in delivery healthcare service, and proposal on serious cross-border threats to health. For the first two, we are expecting to have Council conclusion, and especially through the joint meeting of the Chief Dental, Medical and Nursing Officer, the theme of which were the primary health care approach, an innovative multi-sectoral approach and attempt will be made to collect and highlight best and innovate practice that will promote health generally and more specifically oral health. It is obvious that the oral health is strongly related with the priority set by the Cyprus President. Our aim as Cyprus President is to reinforce the issue that the oral health is essential to quality of life and should be included in all preventive strategy that will ensure health aging. Beside emphasis will be given to send the message for the need to develop the role of a range of health and social care professional and oral health promote as part of their broader health as well-being promotion responsibility, as well as to develop the role of the oral health professional in genetic health promotion to address common risk factors. Any improvement in the oral health not only will improve the quality of life, but will also contribute to the significant reduction of the health care cost. Thank you very much for the attendance.